Hi, I'm Dr. Was. I'm a part-time GP and part-time aesthetics doctor in the Northeast. Today we'll be talking about the temple hollows, how to fill them, which product to use, and how to get the best result. When it comes to the temples, this is a very overlooked area. Most people talk about the tear troughs, they talk about the cheeks, the lips, the jawline, the noses, but the temples are one of those things that seems to be overlooked for some reason. Now, it's quite an important area because it can be a significant sign of aging, and it allows for the transition from your frontalis across into your zygoma and around your eye. Now, the lack of fat in this area as we age, muscle and bone resorption causes a more skeletalized appearance, and that is a sign of either ill health or aging. So what can we do to revolumize this area? Well, we can use our filler with different techniques, but it's quite important to understand the anatomy of the temple to allow you to choose which technique you'd prefer to use. So what is the anatomy of the temple? Well, the temple has 10 layers, and it's quite important to know what is in each layer. That will then guide you with your subsequent treatment. So layer 1 is your skin, layer 2 is your subcutaneous fat, layer 3 is your superficial temporal fascia, layer 4 is your innominate fascia, layer 5 is your superficial deep temporal fascia, layer 6 is your superficial deep temporal fat pad, layer 7 is your deep temporal fascia, layer 8 is your temporalis muscle, layer 9 is your pericranium, and your final layer is layer 10, which is bone. So the importance to know these layers allows you to understand where you're going to put your filler. So in layer 3, the superficial temporal fascia, this houses a superficial temporal artery and a superficial temporal vein, two fairly significant vessels. In layer 4, you have your facial nerve, and in layer 6, you have your middle temporal arteries. In layer 8, the final layer, which has vasculature in the temple, that's your temporalis muscle, and this houses your anterior and posterior deep temporal arteries. So the importance of knowing where your vasculature is will then allow you to figure out where to put either your needle or your cannula. Now there's two techniques to treating the temple. One of them is a commonly known procedure called the gunshot technique, and that essentially uses a 30mm 27 gauge needle, and you inject your high G' products such as Kysense Extreme or Volume directly onto the periosteum. This allows the tissues to lift and creates a nice volumizing effect, and also supports the eyebrow and pulls everything backwards to give a little eyebrow lift and fill in the temple hollows. The only caveat with this technique is that your needle tip, although you feel like you're sitting on the periosteum, often lies in the temporalis muscle, and this muscle houses the deep temporal arteries. So there is a higher risk of a vascular occlusion using this technique. Now in this workshop, we're going to teach you how to inject the temple using a cannula. Typically this will be a 25 gauge 50mm cannula. It's big enough and blunt enough so that it won't puncture any arteries, but it's also long enough to reach the temple or the crest of the temple. Now we'll be putting our entry hole just anterior to the hairline, and we'll be going very superficially, so we're aiming to be in layer 2, the subcutaneous fat. This layer is devoid of any arteries or big vessels, so there's no chance or a less of a chance of creating any drama of going into any big vessels such as the superficial temporal artery or vein. I often pre-bend the cannula, and we'll show you this in the workshop, so that it keeps you superficial and you've got less risk of going deep and start to go into these kind of structures. So the landmarks that you'll need to know are using surface topography. So the most sort of superior landmark will be your temporal crest or your temporal fusion line. If you struggle to find this, it's very easy. If you just grit your teeth and just palpate over this area, wherever there's movement, that is your temporalis muscle, and wherever there's no movement, that's your frontalis. And the junction between the two is your temporal fusion line, and you can feel it or even see it in some people, so that will be around here. Then your next border is your orbital rim, so that's your orbital thickening just around here. And then your lower or your most inferior landmark is the superior border of your zygoma, which is just here. And this section here is your lower temporal compartment, and this section above there is your upper temporal compartment. Your hairline acts as the next posterior boundary to your temple, and that shows all the landmarks for when you're drawing up your temple as to where you can then inject safely. Now, injecting the temple, it's not painful. You don't necessarily need any topical anesthetic or analgesia. However, you're welcome to use this. It's not a problem. As you do start to inject, you may notice some vascularity appearing. Things start to go red, a little bit bumpy, but that's not a problem either. It's just a case of massaging it and letting it settle in the first couple of weeks. Kysense Precise and Kysense Define are perfect for this area. They work very well. They blend in very well with the tissues, integrate lovely, and you get a nice result by 2 to 4 weeks. Although most of your results are instant, you will find in the next couple of weeks there will be a gradual improvement. However, any lumpiness, any swelling, that will dissipate over time as the filler works its way through.